Hemablock is a proven sterile hemostatic powder to control bleeding during all types of surgeries, dental procedures, and topical applications. Hemablock is available in two different presentations: the resealable sterile tube with the powder contained in a foil pack and the pre-filled sterile applicator. Hemablock is classified in the United States by the FDA as a medical device for veterinary use. As a medical device, it does not require registration approval. Hemablock is 100% plant-based. It is composed by 50% microporous polysaccharide beads derived from potato starch and 50% oxidized cellulose derived from cotton fiber. MPB is the primary clotting agent. The combination of MPB and oxidized cellulose increases the strength of the clot. Hemablock can be used to control bleeding during a wide range of surgical procedures, dental procedures, and non-sterile applications in companion animals like dogs, cats, horses, birds, reptiles, and other exotic species. Hemablock has a neutral pH. It can be used in internal surgery and will not deactivate the body's natural clotting capability, resulting in accelerating the clotting cascade. The clot created by Hemablock can be enclosed in the wound and will not expand, allowing usage in areas that could be sensitive. The absorption of the clot will start almost immediately and will absorb completely in just a few days. Hemablock is non-toxic, lickable, and uniquely safe for the patient. It does not irritate or leave dark stains and is pain-free. Hemablock's capability to control bleeding in a short period of time can reduce the cost of surgical and dental procedures. This also results in less stress to the patient and less time under anesthesia. Freshly opened, Hemablock can be used in all types of internal surgeries and procedures. The remaining powder can be used in dental procedures and non-sterile applications. Some procedures where Hemablock can be used are surgeries, biopsies, spays, neuters, traumas, and also during arterial or venous bleeding. Other procedures where Hemablock can be used are lobectomies, amputations, joint replacements, mass or tumor removals, or orthopedic surgeries. Hemablock can also be used in enucleations and neurosurgery. It is not recommended in the spinal area. Hemablock can be used to control bleeding during all types of dental procedures and applications. Hemablock is perfect for tooth extractions. After the extraction, just fill the cavity with Hemablock and apply steady pressure for 1 to 2 minutes. Hemablock can be used in all types of non-sterile applications like seepage along the suture line, declaws, nail trims, and all types of topical wounds and injuries. For nail bleeds, place a small amount of powder in a pad, then insert and hold the tip of the bleeding nail into the powder for 1 to 2 minutes. Hemablock is versatile, easy to apply, cost-effective, and does not require any special storage conditions. It doesn't require premixing or the addition of other ingredients. The two presentations of Hemablock consist of the foil sachet in a sterile resealable tube and the sterile pre-filled applicator. These two presentations allow for easy and versatile ways to control bleeding during a wide range of sterile and non-sterile procedures and applications. For successful results, the Hemablock 5-step rapid application procedure must be followed. The Hemablock 5-step rapid application procedure consists of first removing the excess blood to visualize the bleeder. Second, immediately apply a liberal amount of Hemablock powder directly onto the bleeder. Third, steady pressure must be immediately applied for 1 to 2 minutes. Fourth, irrigate to visualize hemostasis or any bleeders that might have been missed. Lastly, hemostasis will be achieved.
Hemablock hemostatic powder is a sterile, bioabsorbable blood clotting agent. Use Hemablock in just about any sterile surgical application, like this liver biopsy. First, remove excess blood with a gauze pad or with aspiration in order to visualize the source of bleeding. Quickly apply a liberal amount of the powder using our pre-filled syringe applicator. Insert the syringe tip into the wound site and use an excess amount of powder to ensure that the clot forms in contact with the underlying tissue. Light pressure with a non-stick Telfa pad or glove finger for about 1 minute will ensure hemostasis. Slowly remove the pressure so the sticky clot matrix is not disrupted. Take care not to dab the site, as this will often dislodge the clot. The clot will not break down with water. A saline lavage is recommended to visualize hemostasis and ensure that there is no fringe seepage. Reapply powder if any oozing is noted or if the clot becomes dislodged. After a brief inspection of the wound site, you are ready to close without worries of hematoma or foreign body reaction. Hemablock will not migrate, and it absorbs enzymatically in just a few days, not weeks. Perfect for any soft tissue surgery, including spays and neuters, mass removals, as well as dental procedures and topical trauma treatments.
Hemablock powder is used to control bleeding on the femoral artery following the Hemablock 5-step rapid application procedure. A generous amount of Hemablock powder is administered directly to the bleeder and pressure is applied immediately. Steady pressure needs to be applied for 1 to 2 minutes to allow time for the clot to be created. The clot created shows successful hemostasis. Hemablock is 100% plant-based, containing no animal components, and has a neutral pH, allowing it to be used in sensitive areas. As a sterile powder, Hemablock can be used in a wide range of internal surgery, dental procedure, and topical applications.
So it has already formed a barrier, so the blood doesn't with you need to apply. This is the same as if you apply powder pressure. So now you have a clot. If you do this with Vetspon, only you have a wet sponge. It doesn't dry, it doesn't form a gel. So now you have clot, but it's sticky. So it's important to put pressure to the underlying tissue. So 1 minute or less.
That's less than that.
We recommend that you use Telfa pads instead of gauze.